Hi, my name's Ashley Sprout, and I chose my presentation to be on restraints. The learning outcomes are to explore the different types of restraints that are used today in the healthcare field, examine why restraints are commonly used on patients, and examine why restraints are discouraged by many facilities today. The first CUSIN competency that I chose was teamwork and collaboration. Anytime that restraints are going to be used on a patient, they require a physician's order. Along with that, you need to have a decision determined by the interdisciplinary team. That team consists of physicians, family members, nursing staff, and even the social workers. The second CUSIN competency that I chose was safety. I feel anytime restraints are being used, it falls under the CUSIN competency of safety. Restraints may be used to protect the patient. They may also be used to protect staff members. Often restraints are used for patients who are disoriented or suffer from a form of dementia. Prior to a restraint being initiated, there must be an assessment done to determine what type of restraint and if a restraint is really necessary. A restraint should always be the last resort. There are many different types of restraints out there. Physical restraints is a device that is attached to a patient's body and cannot easily be removed. Types of physical restraints are jumpsuits, seat belts, abdominal binders, mitts, and even side rails. Chemical restraints is a type of medication often used to help control behaviors of patients. Types of chemical restraints are psychotropic medications such as Haldol, risperidone, anti-anxiety medications such as Ativan, and even pain medications such as morphine or oxycodone. Maybe these patients are having a lot of pain and that's why they're having these aggressive behaviors. There are a lot of common uses for the restraints. Patients may have IVs and they're trying to pull out the tubing. They may have feeding tubes, catheters, and they're trying to pull those out. In that case, an abdominal binder or even mitts would be an appropriate restraint. Your patients may be at high fall risk or have frequent falls, so they may have a seatbelt on their wheelchair. The next three, physical agitation, aggressive behaviors, and dementia, would all be used with chemical restraints. Anytime you're dealing with restraints, there are a lot of safety concerns. The utmost would be dignity. Any patient that has a restraint it is a dignity issue. Restraints may cause more harm than good. By this I mean it has the potential to cause pressure ulcers if the skin's not being checked where the restraint is. The patient may even have suffocation. Also, it can decrease the quality of life of patients. They're going to lose their independence. They may not be able to feed themselves or get up to go to the bathroom. They may become incontinent. They may even have more falls. Restraints may just be unsuccessful. It may not be an appropriate intervention for some patients. The importance in nursing practice is that facilities continue to use restraints due to the convenience. They may be short-staffed, they may not want to deal with the issue, so they decide to use restraints on the patients. Restraints always require monthly review to determine that they still are appropriate for the patient. Again, they should be used as a last resort, and the least restrictive restraint should be used if one must be used at all. My thoughts on restraints is that other interventions should be trialed first. They are a huge safety risk. So if they have to be used, please remember to do your frequent skin checks on the patients just to ensure that they're not getting any pressure ulcers. These patients may be at a higher risk for injury, so they need to have closer monitoring. I do understand that some patients may benefit from restraints, especially ones who have feeding tubes and they're constantly pulling them out. It's not going to do any good for a patient to not have their feeding tube in. So in that case, yes, the restraint would be appropriate. If you have to use a restraint, just please remember to utilize the least restrictive one if possible. Closing thoughts are, there's always pros and cons to everything, but restraints have a lot more harm than good. in the end, if you do have to use your restraint, make sure it's a team effort to determine what type of restraint should be used. Make sure you're using the least restrictive restraint. And in the end, remember, patient safety is your #1 priority. Thank you, and I hope you learned a lot about restraint.